So you've been lied to about COVID from the establishment and the big pharma-funded media, right? So I bought the propaganda for a little while until I got vaxxed, and then I got vaccine injured, and I started to be treated for it with ivermectin, and I questioned my doctor who was treating me, and he then explained to me about ivermectin, that, Jimmy, they're lying to you about ivermectin, it being horse paste, that it's actually a Nobel Prize-winning medicine that's on the WHO list of essential medicines, that's been prescribed billions of times, saved billions of lives. It was looked as a wonder drug before COVID. It could even cure cancer. That's what they're still looking at it to do right now. And I said, well, why would they lie about it? And he told me because if ivermectin could treat COVID, then they couldn't get their emergency use authorization for their vaccine. So that's why there was a full-on court press from not only the FDA, the CDC, Fauci, but your corporate media, because they're funded up to 70% by big pharma. And so now a couple of doctors had a lawsuit against the FDA over it, and they settled, right? Before they went to court, the FDA settles ivermectin case, agrees to remove controversial stop it post, right? So the U.S. Food and Drug Administration has agreed to remove social media posts and web pages that urged people to stop taking ivermectin to treat COVID-19, according to a settlement dated March 21st. Within 21 days, the FDA will remove another page titled Why You Should Not Use Ivermectin to Treat or Prevent COVID-19. That's according to the settlement, which was filed with the federal court in southern Texas. The FDA has not authorized or approved ivermectin for use in preventing or treating COVID-19 in humans or animals, the page currently states. It also says that data do not show ivermectin is effective against COVID-19, despite how some studies that it cites shows ivermectin is effective against the illness. The FDA in the settlement is also agreeing to delete multiple social media posts that came out strongly against ivermectin, including one that stated, "You are not a horse, you are not a cow. Seriously, y'all stop it." And there it is.
I thought I was a cow.
So I remember
Thanks, FDA.
I couldn't believe this in 2021 when I showed it to Dr. Robert Malone, and he said that was disgusting that they did that, and it was disgusting. And in exchange, doctors who sued the agency are dismissing their claims against FDA. So in exchange for FDA loses its war on ivermectin and agrees to remove all social media posts and consumer directives regarding ivermectin and COVID, including its most popular tweet in FDA history, says Dr. Mary Talley Bowden, one of the doctors, said in a statement, "This landmark case sets an important precedent in limiting FDA overreach into the doctor-patient relationship. FDA can inform, but it has identified no authority allowing it to recommend consumers stop taking a medicine." That's what the judge said. Circuit Court Judge Don Willett, appointed under President Trump, he wrote for the court. An FDA spokesperson told the Epoch Times in an email that the agency has chosen to resolve this lawsuit rather than continuing to litigate over statements that are between 2 and nearly 4 years old. It's the FDA has not admitted any violation of law or any wrongdoing. They're just going to settle, though. They're just going to settle. They disagree with the plaintiff's allegation that the agency exceeded its authority in issuing the statements challenged in the lawsuit and stands by its authority to communicate with the public. But you're just going to cave anyway. Even though you still believe it, you're just going to cave.
It's not worth arguing about.
It's not worth it. So, yeah.
Let bygones be bygones.
The FDA has not changed its position that currently available clinical trial data do not demonstrate that ivermectin is effective against COVID-19. The agency has not authorized or approved ivermectin for use in preventing or treating COVID-19. Dr. Robert Apter, Bowden, and Merrick brought the case in 2022. They said they suffered repercussions after prescribing ivermectin for patients with COVID-19 and that the FDA was to blame. Dr. Apter, for instance, said that a pharmacist refused to fill the prescription, citing the FDA. This refusal delays his patients in obtaining their prescribed treatment when early intervention is paramount, while they look for a pharmacy to fill their prescription if they can find one at all, the suit says. Ivermectin was approved. Okay, so here's Pierre Corey, friend of the show. He said, "Huge win for doctors and patients today. Americans should rejoice that we got the FDA to get out of the practice of medicine. They knew they did not have that authority, but did it anyway. Now they have to take everything they did against ivermectin off the internet." Here is Paul Mitchell, says the U.S. Food and Drug Administration has agreed to remove social media posts. The government lied as usual, and he says ivermectin works, just like I and others said years ago. But I just want to remind people that when people were saying this back in 2021, I knew this was a lie, that ivermectin was some kind of horse poison and that it's a dangerous medicine.
Horse goo.
And it's horse goo. And so when
Makes you blind.
someone tweeted this out, literally people won't take the vaccine because they are super suspicious of that, but they're taking horse deworming medication that they're buying at a feed store for COVID.
The feed store.
And she hashtag Maddow. So I went and this is literally from the a medical journal. It says use of ivermectin is associated with lower mortality in hospitalized patients with coronavirus disease 2019. And that's a study. That's a real study. So I just linked to it without comment.
Mm-hmm.
And then this is Ken Klipperstein from The Intercept. And he retweeted and said, Jimmy Dore is a horse dewormer med guy now.
LOL. He was lolling.
So that's the kind of guy. I just want to know what medicine he's taking that makes his face swell up like that. But anyway,
what kind of square head goo is he taking?
So we've all been there. And Sean Lennon tweeted, remember when we were gaslit about ivermectin? Yes, that was funny. Well, guess who we have with us? One of the doctors who got this done, filed this lawsuit. Mary Talley Bowden is an ear, nose, and throat specialist who studied medicine at the University of Texas and Stanford University. She successfully treated more than 5,500 COVID-19 patients without a single death, but was nevertheless suspended by Houston Methodist Hospital over alleged vaccine misinformation. She and her fellow plaintiffs just won a huge legal victory over the FDA, which has agreed to remove all social media posts and consumer directives regarding ivermectin and COVID, including its most popular tweet in FDA history. Please welcome Dr. Mary Talley Bowden. Thank you very much for making time. So,
thanks for having me.
So you've been a victim of the big pharma-funded attack dogs. Tell us what happened.
Well, it's a daily hurdle since basically FDA launched this war on ivermectin, but more importantly, they launched a war on the doctor-patient relationship. And, we've been in this for 4 years, and almost a daily basis, I'm reminded of what they did. When they went on that social media PR campaign, they changed the narrative. They denigrated ivermectin as an animal drug, not safe for human use. And I had a hard time getting pharmacists to fill it. I had to convince patients it was safe. I had my license threatened. So it's been an ongoing battle for 4 years now, and I am just thrilled. I'm like a kid on Christmas morning today.
Well, congratulations for a big win, and I appreciate you doing the hard work and pushing back against the FDA. What happened with Houston Methodist Hospital? What was that all about? Why they got rid of you for telling the truth about something?
Right. So this was the fall of 2021, and they were the first hospital in the country to mandate the COVID shots. They did not appreciate me speaking out. And back then I was pretty cautious about what I said, but I basically said vaccine mandates are wrong. And I said it 25 times in one day on Twitter. And I put a patient testimonial on there. And then 5 days later, I'm notified by a reporter at the Houston Chronicle that they were suspending my privileges for spreading dangerous misinformation.
So all you did was come out against mandates. You didn't say anything about the efficacy of a vaccine. You were just basically doing what I was always taught my whole life as a lefty, someone who considered themselves on the left politically, that you have bodily autonomy.
That's misinformation.
And that you're pro-choice, right? And so being pro-choice means that you get to choose what goes in or out of your body between you and your doctor, and the government can't get in between you and your doctor. And that's what I always thought pro-choice meant. So now all those people who were pro-choice their whole life, I don't know if you've noticed, doctor, they no longer say they're pro-choice. Now they say they're pro-abortion, which is the craziest thing I've ever heard in my life. Nobody's pro-abortion. That's like being pro-slaughter and genocide. Nobody's for any of that stuff. When an abortion happens, I just want the doctor and the patient to make that decision and not the government. That's called pro-choice bodily autonomy. Have you noticed that?
Yeah, the hypocrisy has been a running theme throughout the pandemic, right? So, and this is just a prime example that, rules only apply depending on what the situation is, but there's no consistency whatsoever.
And so did people, so are you still able to practice medicine even though you got fired from that hospital?
Yeah, so they reported me to the medical board, and it's been 2.5 years, and I'm still fighting it. I have a hearing coming up on April 29th. My legal bills just passed the 100,000 mark. I mean, it's absolutely ridiculous.
So do you have a GoFundMe or anything that you're helping to pay for your legal bills, or how are you doing that?
Yeah, there's a GoFundMe, and it's been okay so far. I think the hearing's going to make a little dent in things, but so far we've been okay.
Do you see a tide turning now against the COVID narrative?
Most definitely. I mean, it started in November. Texas passed basically you can't mandate the shot law. It wasn't 100% the way I'd want it, but it's getting there. And then this is a second major landmark movement in the right direction. And then the next step is to get the COVID shots pulled off the market. That's my goal.
Oh, okay. So but the FDA and the CDC, they still recommend the COVID shots for children, pregnant women, elderly, everybody. Am I wrong about that, or have they pulled back?
No, 6-month-old children are expected to get these shots. It's a travesty. It's unbelievable. That's all risk and no benefit. And I have a growing list of politicians who are calling for these shots to be pulled off the market. You can go to my website, americansforhealthfreedom.org. We have over 250 elected officials and people running for office who are all simply willing to state that the COVID shot should be pulled off the market.
I know I heard Dr. Robert Malone say that for sure. But of course, the FDA, they're the final word on this. And the FDA and the CDC, they say it's still safe and effective and that it'll stop you from getting seriously ill or hospitalized from COVID. So that would mean that you're wrong, right?
Well, Congress can do something about that. We just need people to actually do something. And you know that most of the people in Congress are not getting 9 shots, right? And they're not giving them to their children. So they need to speak up, because if they're not safe enough for them, if they're not safe enough for their children, how are they safe enough for their constituents?
So what you're saying is that the uptake of the booster shots is at an all-time low. The last time I checked, I think it was at 6% of the population has taken are up to date on their boosters. So by my count, it would be you'd have to be on your 10th shot if you got double vaxxed. You'd be on your 10th shot, but maybe I'm wrong. Is it 9? What have you been counting?
I understood it was 9, but I'll give you 10. Maybe. Either way, it's ridiculous.
Okay, so maybe, boy, I can't imagine getting 9 of those shots, but and then it's just in perpetuity. They expect people to get the boosters, right? Because you have to keep getting it over and over and over. And I always say it's funny, they changed the definition of what a vaccine is, right? You know that, correct?
Oh yeah. Definitely.
What was the definition of a vaccine before? Do you know?
Oh God, I just know. I mean, common sense. It prevents you from getting an infection, right? And
yes.
And then now, suddenly, that's changed. I can't remember the technicalities, but
So now the new definition is that it promotes an immune response. So before it used to prevent you from contracting a virus, and now it promotes an immune response, right? And so now it's. The joke that I like to make is I go, so we all got the COVID-19 vaccine and then we all got COVID. Is that how vaccines work now? Can you imagine if we all got the polio vaccine in the same year we all got polio? I'd be like, hey, I don't think that polio vaccine works really well. Why do you say, Jim? I got polio, right? and then there's always some guy, well, it's not supposed to stop you from getting it. It's just supposed to lessen your symptoms. Okay, all right. Because that's what they say now, right? That's what the COVID-19 vaccine is. It's not supposed to stop you from getting COVID. It's just supposed to lessen your symptoms. That's what they say, right?
Right. And that's so clinically, we had that third surge the summer of 2021, and this was after the COVID, it was 8 months after the COVID shots had rolled out. And clinically, what I was seeing, the vaccinated were outnumbering the unvaccinated, and they were just as sick, if not sicker. And I actually went to Methodists and I said, hey, are you seeing what I'm seeing? And they just completely dismissed me.
Why do you think that the medical profession in en masse went along with the COVID narrative from Big Pharma and Dr. Fauci? Why do you think there wasn't more people like you? Why are you the outlier?
Well, look what happened to me. I mean, Methodist Hospital targeted me, right? I spoke out and then they made my name global. I mean, the story literally went global. And I'm just this solo physician in a suburb of Houston with a very quiet practice. And all of a sudden, I can't go to the grocery store and make eye contact with people. It really changed my life. And, why would you bother doing that, right? I'm different. I have a very independent practice. I'm not employed by anybody. My livelihood doesn't depend on anybody but my patients. So I say, the only people I work for are my patients, but most doctors can't say that. Most doctors have contracts with the government or the hospital, or they're beholden to insurance companies. So they're not really working for the patient. They're working for a third party.
And so that's why you think Methodist Hospital went after you so hard, because of they were being paid by somebody?
Well, I think it's probably multifactorial. I think Methodist was chosen to be the first hospital in the country to mandate the shots. I feel like they figured if they could get away with it in the seemingly red state of Texas, they could get away with it anywhere. So I think it was a testing ground. And then, it was just, there's probably lots of money, there's lots of ego, there's lots of power involved. I don't know which one was the predominant force, but yeah, I always say that the COVID shot is just too big to fail.
Did they get away with it?
They won't.
Okay.
We're changing it, right? But you can't win a war in a day, right? And
right.
we're at the 4th year, and the direction of the war is turning.
Our doctors, so like I've gone back and I had one interaction with a doctor who was there the day I got my vaccine, and he assured me it was safe and effective. And when I went back to him and I was like, I told him, and aren't you embarrassed? And he just pretended he didn't hear me.
Oh, right. Mm-hmm.
I'm really surprised that doctors have such little integrity and such little spine, and they're just like most people in most professions. They are just go along lemmings who don't really have much character, and that's why it's when people like you really stand out.
Well, I mean, I look at, to become a doctor, you have to make straight A's. You have to be a very good student. You have to be compliant. You can't be a troublemaker, right? Mm-hmm. And our training is, I mean, I've never been in the military, but I imagine it's similar. I mean, it's very rigid. You don't go outside the lane. It's very, follow directions from day one. And if you deviate, you are out. I mean, it's very strict like that. So I think it attracts and it breeds compliance. And that's the majority of doctors.
So are your patients appreciative of you? Did you lose a lot of patients, or did you gain a lot of patients, or has it stayed about the same?
It's hard to say. I got a lot of reaction, good and bad. But it's nice because the people that come to see me, they're very like-minded. So I never feel like I'm, I kind of actually feel bad for the other doctors, because I hear so many people say, I just have lost complete faith in my doctor. And I think the other doctors on the other side get a lot of negative feedback. And I'm sure it's not very fun for them to go to work every day.
Okay. Well, is there anything else that, by the way, where's your GoFundMe? Where can people find your GoFundMe?
It's just on GoFundMe, I think.
Dr. Mary Talley Bowden.
Yes.
If they go to GoFundMe and look up Dr. Mary Talley Bowden, we'll try to find it and put a link under the video here. And we could also, what is your website that you wanted to point people towards?
That AmericansForHealthFreedom.org. So we're just trying to get more politicians to speak out.
Okay. Anything else you'd like to say before we say goodbye?
No, but I think this should give everybody some hope, right? I think the direction of the war is changing, and I'm optimistic that the next step will getting these COVID shots off the market.
Did you see where the Attorney General of Texas is suing Pfizer for false advertising, right? And so, I don't know if you remember, but last year there was a push to impeach him.
Yeah.
And I remember that news item kind of came across my desk, and I was like, that's pretty odd. I'd never heard of that, trying to impeach a attorney general of a state. And, I felt like it was too local of a story for me to
Never
cover.
heard anybody suing Pfizer who's attorney general.
That's right.
It's a big divide in Houston and in Texas. There's a big divide amongst the conservatives. They're basically the rhinos versus the people that are not rhinos. Ken Paxton's sort of on the not rhino side, and there are all these others that are against him. And it's a very interesting political scene in Texas right now.
Well, I just don't understand how people who consider themselves political conservatives could go along with authoritarianism like that at the service of big pharma, of
for big pharma?
the combining of Mussolini said the definition of fascism is corporations and the state combining together to screw the regular citizen, and that's exactly what happened during COVID. So how do you think those people square that circle in their mind if they consider themselves a America First conservative?
That's an excellent question. I mean, we need to figure that out so it doesn't happen again, because just look what happened the last 4 years, how the brainwashing and the gaslighting is just intense and real.
It's intense, it's real, the authoritarianism, the fascism. People think it's going to come to our country at some day. I'm like, you've been living through it for quite a while. This is what it is.
It just hasn't gotten around to you specifically yet.
This hasn't gotten to you specifically.
But they've gotten around to quite a few people, actually.
That's right. Well, they fired 70,000 healthcare workers in one state alone, in New York. One state alone, they fired 70,000 healthcare workers because they wouldn't go along with the mandated vaccine. That's 41% of all black-owned businesses are wiped out, never coming back because of the lockdowns, which had no science behind them.
You could be debanked.
You could be.
That's a thing.
Yeah,
you're being debanked.
Yeah.
What?
I know. That's what they did to the truckers in Canada, right? They froze their assets. And again, the truckers in Canada were vaccinated at a higher rate than the general population. They weren't protesting medicine. They were protesting bullshit authoritarianism. And they were right. In fact, the Supreme Court of Canada just agreed with them last month. So anyway, Dr. Mary Talley Bowden, I really appreciate your work. Thanks for standing up for people like us and pushing back against authoritarianism and fascism and big pharma and, having integrity. It's refreshing. I appreciate it. And congratulations on your big win over the FDA.
Thank you so much, Jimmy.
Hey, come see us do a live stand-up show. We're going to be in Stockholm, Amsterdam, Rotterdam, London, Oslo, Stroudsburg, Pennsylvania, Cortland, New York, Oakmont, Pennsylvania, El Paso, Texas, San Antonio, Texas, Edmonton, Alberta, Vancouver, British Columbia, and Denver, Colorado. Go to jimmydore.com for a link for those tickets.